us?
I can't hear you either.
Yeah,
Let
so
me do this again.
yeah, but
Let me go
Kim,
out for a minute.
yeah, Kim, I think it's happened before when we've done these calls.
So Natasha, I muted you there just for a second. So to all our journalists on the line, as you can see, we're just getting one of our participants set up. So Fidela, just to let you know that my microphone is open, and we will be with you momentarily. Please apologize for this live testing. That's how we roll here these days, and just stand by.
Hello, Hindi interpreters. This is a sound check, please.
Okay. Can you hear me now?
Hello, yes we can. Thank you so much. That's great.
Oh, okay.
Okay, thank you. So what we'll do is we're going to mute. You can mute and unmute as you want. You can leave your video on as you want.
I hear you both. Thank you very
much. And we'll
much.
probably be starting in a few minutes, maybe.
Now, I see you and I see myself in a very small corner. I don't see the other. Is that correct?
That's
okay. Perfect.
I think that's just how it is on your phone. And I'm going to spotlight you as you speak,
please.
and I'll spotlight Natasha as she speaks.
Okay, perfect.
Thank you so much for joining us today. This is a very exciting day for us.
Great to be here.
Excellent.
Thank you for the opportunity.
Yes. Natasha?
Yeah?
Yeah, you can hear me well. Okay, good. Yeah. I can hear you now, too.
2, 3, test.
Oh, no.
Hmm?
Is that how you do it? How do you know?
Hello, everybody. This is Fadila Shaib speaking to you from WHO headquarters in Geneva and welcoming you to our COVID-19 press conference today, Monday, 19 October, and happy to moderate this press conference. Today, we have the privilege to welcome some very special guests remotely that Dr. Tedros will introduce. In the room, joining Dr. Tedros, we have Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria Van Kerkhove, Technical Lead, COVID-19, Dr. Soumya Swaminathan, Chief Scientist, Dr. Mariangela Simao, Assistant Director, General Access to Medicines and Health Products. Now, without further ado, I would like to hand over to Dr. Tedros to introduce our guest and give his opening speech. Dr. Tedros, you have the floor.
Thank you. Thank you, Fadila. Good morning, good afternoon, and good evening. I want to start the week off on a happy note. I'm delighted to announce that WHO has the honor of working with Kim Sledge of the legendary group Sister Sledge and Natasha Mudhar, founder of the World We Want organization. Together, we're ready today announcing the start of a new We Are Family campaign to promote global solidarity and collaboration in the face of COVID. We're Family is a global anthem that calls for what the world needs most right now: solidarity, unity, and collaboration. Working together as a global family for the future. I would like to thank Kim Sledge for her kind offer to donate proceeds from the sale of her special edition cover of We're Family to the WHO Foundation. This is in support of the COVID-19 response and strengthening health services around the world. I would also like to announce that we will have the honor of having Kim Sledge sing We Are the Family at the opening of the 73rd World Health Assembly, which resumes on the 9th of November. I now would like to introduce Kim Sledge and Natasha Mudhar to describe the motivation for the We Are Family campaign and how it will work. Kim, the floor is yours.
Unmuted?
Can you unmute?
Is that better? Can you hear me now?
Yes, yes, now good.
Ah, there we are. Hello, Dr. Tedros. What an honor it is to be here. And hello, other wonderful, privileged and esteemed guests. Oh, I am so honored to be here today. I am so grateful to be a part of this very, very real and sincere desire for the world to unite, particularly those here, you, your heart and your ways and your voice, and what I've heard you say about how the world needs to be united. And this is a solidarity effort for a global concern. We all, every tribe, every tongue, every nation, every people have the banner of love over us and desire to bring us together in this world to fight the kinds of things that come against who we are and lifting our generations. So a very, very dear friend of mine, Mr. Lou Weisbach, from Chicago called me one day and he said, listen, I have in my heart the desire to have us come together to begin to fight this pandemic that is attacking our world. And he had been working on something for quite a long time with this. And he felt that We Are Family was the perfect song to bring the world together for this. Well, I called my dear friend Natasha Madar from The World We Want and in London. And she said, Kim, that's an incredible idea. Let's come together on this. So we've come together here today with that privilege and that challenge to come against this, fight against it. And I know together we are Unity Strong and we can do this as a family because we are one big global family. I am so excited and I'm so honored and I am so taken in my heart to do whatever I can as humankind to bring our hearts together and fight this. And there's a verse that my mom used to always say. She said, where there is unity, the Lord commands a blessing. Where there is unity here, and the blessing will be fighting against this. And eventually one day this being wiped off of our planet because it has no right to take the lives that have been taken. And together with what we've been given and our gifts and what God has given us in terms of our desire to live and to preserve life, I know we will win against this. So I'm thanking you today for the honor of being here. I'm thanking you for where your heart is. I'm thanking my friend Lou Weisbach for his esteemed work towards this, for my dear, precious friend, Natasha Mudar, who has pulled us all together. So that's why I'm here. It's time to go for it. The banner over us is love, and together we are Unity Strong because we are family. That's why I'm here. And, well,
thank you. Thank you so much, Kim. That was really wonderful and uplifting.
Oh, thank you. Thank you, sir.
To quote you again, we are one big global family. That's what you said. So yes, thank you so much. And then you also said, I know we will win.
Yes, we will.
That's it. So thank you so much indeed. And I will add to that, together, we will do it. We will win. Thank you. Thank you so much, Kim. Much gratitude from all of us here.
And Dr. Tedros, I wanted to say something to you real quick. I don't want to interrupt you, but I want to say this. We are family. I got Dr. Tedros with me.
We have been trying here also. You will listen to our product in a few minutes. I hope we haven't done. I hope we have done some a bit. Yeah, thank you again. Now I would like to hand over to Natasha Mudhar of The World We Want. Natasha, you have the floor.
Thank you, sir. It's an absolute honor, absolutely humbled, privileged to have this opportunity to be speaking to everybody here on this panel today, and to share a little bit more about our story as to how the whole of what We Are Family means for us and for this particular project. As Kim said, it's been in the making for a few months now. And I was asked earlier, actually, in another interview that we were doing, is, why now are you releasing this, and why not in March, and why not in April? And the reason why now is because the pandemic that we're all facing is as relevant as it is today as it was 5-6 months ago. And with our music video that we're producing, which will come out towards the end of the year, we want it to be kind of a real clarion call that, this beautiful, real global world families coming together in unity, in solidarity, not just in 2020, but also in looking towards 2021 as well, to address any global health challenge that we ever face, including and beyond the COVID pandemic. And I think what I absolutely love about the project that we've incepted with We Are Family and the new cover edition that Kim has beautifully created is the fact that the mission with the song is to make it the most globally inclusive and diverse anthem for unity and solidarity as best as we can. And by that I mean, yes, we are encouraging all of the biggest, most high-profile individuals in our world, such as celebrities, public figures, prime ministers, presidents, etc., everybody to be involved. But this is really for everyone and everywhere, everyone everywhere. And that's why we are really encouraging the global public to join our efforts in unity and solidarity, to come on board, to record their videos of them lip syncing or singing along to We Are Family, sharing those videos with us on social media, even on our website, unitystrong.com. So we can actually include that in this very cool music video that we're putting together, bringing the whole world together in one music video. Yes, and I think the other thing I'd like to add is the fact that music, we all know, is such a powerful source of energy, comfort, so many memories attached to it as well. But what is so powerful about music, and what we feel will be so powerful about this particular campaign and the song and the video, is that it will not only just entertain, but inspire action. Inspire action insofar as encouraging everybody to be a lot more empathetic, as I believe that's something that we really need in the world, in the here and now, and just really bringing everybody together.
Thank you so much, Natasha. That's really great, and I hope this will inspire action, as you rightly said, and we're very honored to partner with you. Now, back to you, I think, for the in-house video.
Thanks so much to our very special guests. Now back to Dr. Tedros for his opening remarks, to continue his speech. No, before that, I think I will hand over to Paul Gawood, my colleague. He has something to add. Thank you.
Just very quickly, thank you, Fidela. Just very quickly, would like to play a video, the WHO version, let's say the teaser video for the We Are Family campaign.
In solidarity, we're unity strong. So come on, everybody. Let your light shine, because we are family. We are family. I got all my sisters with me. We are family. Get up, everybody, and sing. We are family. I got all my sisters with me. We are family. Get up, everybody, and sing.
Yeah, this was very interesting. Dr. Tedros.
So thank you very much, and I hope, Kim, you enjoyed our version, and look forward to hearing you on November 9. Thank you so much for your partnership again. And to the rest, I mean, to those who had a chance to follow our conversation, I would like you to join us, Kim Sledge, and Natasha, in the new We Are Family campaign. Now moving into the next. On Friday, we discussed the worrying phase that COVID-19 pandemic has entered. As the Northern Hemisphere enters winter, we're seeing cases accelerate, particularly in Europe and North America. It's encouraging to see many leaders communicating with their populations about targeted measures that are needed to slow down the spread of the virus and protect health workers and health systems. As cases go up, the number of people needing beds in hospitals and intensive care also increases. Nurses and doctors have a much better understanding of how best to treat people with the virus than they did in the early days of the pandemic. However, when hospital capacity is reached and exceeded, it's a very difficult and dangerous situation for both patients and health workers alike. So it's important that all governments focus on the fundamentals that help to break the chains of transmission and save both lives and livelihoods. This means active case finding, cluster investigations, isolating all cases, quarantining contacts, ensuring good clinical care, supporting and protecting health workers, and protecting the vulnerable. We're in this for the long haul, but there is hope that if we make smart choices together, we can keep cases down, ensure essential health services continue, and children can still go to school. We all have a part to play. Physical distancing, mask wearing, hand hygiene, coughing safely into your arm, avoiding crowds, and meeting people outside where possible. And when you have to be inside with others, open windows and ensure good ventilation with non-recirculating air. I know there is a fatigue, but the virus has shown that when we let our guard down, it can surge back at breakneck speed and threaten hospitals and health systems. On 9 October, I shared that 171 countries and economies were part of the Gavi, CEPI, and WHO-led COVAX initiative for vaccine access. I'm pleased to announce today that now 184 countries have now joined COVAX. The most recent countries joining over the weekend are Ecuador and Uruguay. COVAX represents the largest portfolio of potential COVID-19 vaccines and the most effective way to share safe and effective vaccines equitably across the world. Equitably sharing vaccines is the fastest way to safeguard high-risk communities, stabilize health systems, and drive a truly global economic recovery. As winter comes, we know that the next few months will be tough, but by working together today and sharing life-saving health supplies globally, including personal protective equipment, supplies of oxygen, dexamethasone, and vaccines when they are proven to be safe and effective, we can save lives and get through this pandemic. As Kim said, we are one big global family. I thank you.
Thank you, Dr. Tedros. Just to inform you that this press conference is being translated into the official UN languages, Arabic, Chinese, French, English, Spanish, but I apologize, today we do not have Russian translation, but we have Portuguese and Hindi. Now I will open the floor to questions from journalists. I remind you that you need to raise your hand. Use the raise your hand function in order to get in the queue to ask your question. So we will start with Naomi from CNN. Naomi Thomas, CNN, I think you have a question.
Hello, can you hear me?
Yes, very well. Go ahead, please.
Hi, my question is actually for Kim, if she's still available.
She is. Go ahead.
I was hoping that she could share with us what she thinks the messaging and the lyrics of the song mean during the pandemic.
Kim, did you hear the question?
Can you hear me now?
Yes, very well. Go ahead.
Okay, all right. Thank you for your question. I will say first what it means. It's very personal to me because I have two members of my family, my husband and my daughter, who are physicians, who are on the front line. So we are family already. The family words are about family, but the world is a family. And those words are calling us together as a family to embrace one another through this time. And I feel that the song itself is one that has been about solidarity. It's about what families do when there's times of crisis, and that is come together, look out for each other, find ways to solve solutions that makes the whole family strong. And this world family will be much stronger as a world family, as we embrace those words, as we attack and bring about what needs to happen to resolve anything that conflicts and causes a problem with our world family. So that's why we are family.
Thank you, Kim Sledge, for these very powerful words. I would like now to pass the floor to Sophie Mokoena from SABC, South Africa. Sophie, can you hear me?
Yes, I can hear you. Dr. Tedros pointed out that the numbers are growing. There are reports in South Africa that we are likely to see a second wave of the pandemic. I just want to find out from WHO, are you sensing that we are heading towards a second wave of these COVID-19? And at the time where our Minister of Health, Dr. Zweli Mkhize, announced yesterday that he tested positive for COVID-19.
Yeah, thank you, Sophie. Dr. Ryan will take this question. Dr. Ryan, you have the floor.
Sure, and our sympathies regarding that positive case again. We're always troubled to learn of COVID-19 and leaders, especially given their need to lead, but also for them and their families. With regard to South Africa is in a sort of steady state. South Africa has come down off a very high level of transmission, down to levels approaching earlier parts of the year, and currently is, I think, reporting about 11,000 cases weekly, about 189 new cases per million population, and very little change in either the number of cases or the rate of deaths. So in that steady state, and you've seen other countries in the Northern Hemisphere reach that steady state and then start to track back upwards. And I think this is what we really need to try and avoid, if we can, avoid that inexorable move towards more transmission. When you look across Africa as a whole, there's a mixed pattern. In general, in the continent, the overall situation for sub-Saharan Africa, for the WHO Regional Office for Africa, is about 31,473 cases for the week, about 1.3 cases, 1.3% of new global cases, and just over 1,000 deaths in the countries in our Afro region, representing 2.9% of new global deaths. So you can see there, the cases may certainly be underreported. We don't believe the deaths to be as grossly underreported, and therefore Africa as a whole is still very, very low down on the impact side of COVID. But the impacts in Africa are being generated by other losses, socioeconomic and healthcare losses as well. So Africa is suffering, development is suffering, society is suffering, and making lots of sacrifices to keep this disease under control. So yes, there is a chance, and we do know from the emerging, and Maria may speak to the availability of seroprevalence data in Africa, it's patchy enough. But again, we're not seeing huge numbers of percentage of the population having history of exposure. So there is still a long way for this pandemic to go in South Africa, in the rest of Africa. But we do believe that the young age profile, the community focus of the interventions so far, and the ability to do good case finding and contact tracing has helped African countries in stemming the worst of this so far. But again, we've seen countries do okay in the first wave, and many countries may have just received a glancing blow, and we don't know to what extent. In some cases, countries got it right, and in other cases, countries were just a little bit luckier than others. But what we're seeing now is the second wave. Even if you look at Asia and South Asia, Southeast Asia, we're seeing countries that were very little affected in the first sort of wave being more affected now. And again, in Africa, we're seeing some countries that had very few cases in the first wave are seeing more activity now than they saw before. So therefore, it's really, really hard to predict what the next wave holds for any country. But what South Africa has done, and to its great credit, it has crushed that curve. It has saved a lot of lives, as many other countries have. The real question now is the extra effort it's going to take to keep that number low, to keep pushing that number down and down and down relentlessly until you reach enough control so that other measures and restrictions on people's lives and livelihoods can be released, and that the public health action linked to the community action is enough to keep this disease under control.
Thank you. I think Dr. Van Kerkhove would like to supplement.
Yeah,
Thank
just
you.
very briefly, just to say that there is no inevitable second wave that needs to happen. And I think that many countries which have, as Mike has pointed out, using the systems that are in place, and many countries in Africa are in this position where they have either prevented an outbreak from happening or have crushed the curve. And so there is no inevitable second wave that needs to happen, because all of the systems that you have in place, and South Africa has put in place, many countries across Africa, all the diverse countries that are there, that are using the system for active case finding, for isolation of cases, for quarantining of contacts, for using the testing system, the facilities that are in place, for getting rapid turnaround tests back as quickly as possible, for using the hospital systems that have been established for providing optimal clinical care. All of that will help prevent a second wave. And I think if there's one thing that we can say to everyone, and we've said this many times, over the summer in the Northern Hemisphere and others, is use your time wisely. In the time that you have brought these outbreaks under control, stay ready, prepare for more, because there could be another wave. And with the global interconnected world that we continue to have, the virus needs people, it needs clusters, to transmit in, and you could be prepared for that. And I think one of the things we need to emphasize as much as we possibly can, the importance of the isolation of cases and quarantining of contacts. And you hear us say this over and over again, but it might be worth mentioning that quarantining of contacts means that individuals ideally could be quarantined outside of their home, but we know that that's not possible all over the world. Quarantining at home for 14 days. That means not going to work. It means not going to the grocery store. It means not socializing with friends. It means not having people over at your home. And people who are in quarantine need to be supported through that, because of course they still need to make a living, they still need to provide food for their families. So it's really important that those who are in quarantine, those who are isolated as cases, and those who are in quarantine are supported through that period. This will break chains of transmission. And without isolation of cases, without quarantining of contacts, it will be incredibly impossible to do. So really, I think we just need to emphasize what that means. And I've had a lot of questions over the last few days from family and friends about what quarantine actually means. And I think it's just worth emphasizing what we mean there. But I wanted to just highlight that there is no inevitable second wave or next peak. It's within our control, it's within our hands as individuals, but also with strong government leadership, clear national plans, implemented with targeted controlled measures at local levels, we can prevent additional subsequent waves of this happening.
Thank you. I would like now to invite Gabriela Sotomayor from Proceso to ask the next question. Gabriela, can you hear me?
Yes. Hola, Fadela. Thank you for giving me the question. I have a question regarding Europe and the cases that we are seeing in Europe and the numbers. What was done wrong? What happened, especially to prevent a dramatic scenario that we saw in March from happening again? For example, in China, there are 5,000 deaths. And in Europe, we have 250,000. In the United States, it's 200,000, sorry. So the contrast in numbers is impressive. So does it have to do with the treatment they are giving in patients in China or in Asia? I mean, what can we avoid? How can we avoid to be in a dramatic scenario again?
I think that's an interesting and complex question that has, I think, complex answers. But if we can be simple, it's not just China. Many countries in East Asia and many territories and health authorities, and the health authorities in Japan, in South Korea, the health authorities in the China mainland, in Taiwan, in Singapore, and in Australia, have made huge progress against the disease and have managed to really crush that curve and keep it down, and managed to sustain that through a very long time of low numbers. I think, and each country has achieved that in a slightly different way. There hasn't been a one-size-fits-all. Each country has had to adapt its strategy to what its social contract is with its population, what its powers are under public health law, what the expectations of community are, what the trade-offs are on the socio-economic side. So you will see countries, though, had some elements, I think, that were very, very, very common in terms of being able to both crush and sustain. One, I think, was a focus on case detection, case isolation, and especially quarantining of contacts. The continued quarantining of, and supporting those contacts in their quarantine, not just sending people home, but supporting them in that process, physically supporting them, providing them with accommodation, providing them with food, providing them with social support. And if you think in any one time in a community transmission environment, between 1 in 400 and 1 in 500 people may be carrying, maybe actively positive for COVID-19 or for SARS-CoV-2. Well, if you imagine that one person is a case and they have 10 contacts, if I isolate that case and quarantine those contacts, that's 11 people who are affected by the measure, as opposed to a lockdown, which is 400 to 500 people affected by the measure. And the success the countries had in Asia was their ability to find those 11 people, find that case and those contacts. Maybe not all the cases, but enough cases to start breaking the chains of time and to continue doing that. Second thing, obviously, there is an advantage in Asia. And again, I think people in Asia, communities in Asia, do have higher levels of trust and compliance in government, and they've tended to be able to implement for longer some of the measures that have been required of them in terms of their own behaviour. And thirdly, I think, and Maria may comment on this, many of these countries had serious follow-through. Once they got the numbers down, they followed through. They didn't start reducing testing centres, they increased testing centres. They didn't start reducing clinical capacity, they increased clinical capacity. In other words, they ran through the finish line and beyond, and they kept running because they knew the race wasn't over. That finish line was false. Too many countries have put an imaginary finishing line, and when they crossed it, may have decelerated some of their activities. The countries in Asia, South Asia and the Western Pacific that have been successful, to my mind, and have really continued to follow through on those key activities. The other thing many countries have done, I think, is had multiple measures. If you look at testing in places like Korea, it's been very intense. It's been very intensive, very deep testing at community level. In Japan, it's not been quite as intense, but they've really focused on cluster investigation. They've focused on really breaking clusters and learning from those clusters what's driving super spreading events in Japan. So again, there's no right answer. There's no one size fits all. Each of those successful countries has taken the tools, all of the tools, and seen how it can apply those tools within its territory, within its social, and then it's followed through on those activities even when the numbers have got low. And it's managed to sustain their community commitment to those measures. But because those countries have been able to open up again, because those measures now only affect small numbers of people, the case and the contacts, and the rest of life has got back to normal, those countries now have an advantage of being able to sustain the effort. It's very tough for countries right now in Europe and North America, going back into another phase of potential lockdowns. People are exhausted, they are tired, and it's not an easy situation that Europe faces or that North America faces. But as Tedros always tells us here, there's always hope. there's always a chance to turn things around. There's always a chance to learn. And I think as we move into the next few weeks, and as Europe and others will experience high numbers of cases, we must protect the vulnerable. We must protect the health system. We must try, if we can, to keep our kids at school. We must also be prepared potentially to give up and continue to give up some of those things that we love to do. But we must be able to test and trace. And in the situation of intense transmission, it may not be possible to trace every case. We accept this. And there are times when that is not the most efficient thing to do. But you must be able to know where the virus is. And as the numbers drop, you must be able to re-engage in tracing, quarantine and isolation. And I think if there's one thing that differs in the responses in Asia and in Europe in general, or the Northern Hemisphere in general, I think it's been that ability to follow through on those activities, and in particular around quarantining context. Maria?
Yeah, just to talk about the follow-through, and I was looking back through some of the earlier peaks in other countries and looking at how long it actually took. And we're not talking about days or weeks here. We're talking about outbreaks that took up to 2 months to resolve with incredible, intense effort focusing on these cluster investigations. I was asked recently about this idea of clusters and this idea of amplification events. And this idea isn't penetrating many places, and we're trying to figure out why. We've talked a lot about how this virus operates in clusters, how it needs people to transmit between, how there are certain types of situations where the virus can be amplified. And this is a hallmark of coronaviruses. And in all of our guidance materials, we talk about these no cases, sporadic cases, clusters of cases in community transmission. And what has happened in many parts of the world, in all the world, and particularly in Asia, the way that the outbreaks have been tackled is doing cluster investigations. So when the situation seemed overwhelming, I think of Korea and the example in Korea and the outbreak there in the beginning of the pandemic, and the situation seemed overwhelming. And what they did, and this was based on their experience with MERS in 2015. So preparedness works, preparation works, experience in dealing with very similar pathogens works, and you see this all throughout Asia. Using the follow-through that Mike just mentioned of active they did incredible amounts of testing, but it was smart, it was strategic. It wasn't everywhere all over the country. It was really focused on areas of intense transmission so that you could break down the fuzzy borders of where those outbreaks actually were. And I think what we can see in Europe now and in North America now, where they're starting to see increases again, is to do the same thing, is to look at the virus is not uniformly spread all over. There are hot spots of activity in certain cities, and if we break that down, where is transmission actually occurring? We know from other outbreaks that there are clues. That they can happen in places where you have enclosed settings, especially where you have poor ventilation. We've seen outbreaks in long-term living facility. We've seen outbreaks in nightclubs and entertainments and restaurants. We've seen outbreaks in hospitals. So if we know this, we can prepare our systems and actually do the types of cluster investigations in those areas that are necessary. But I think many parts of Europe are using the experience that they have. They didn't have experience with SARS previously. They didn't have experience, many cities didn't have experience with MERS. Now they have experience with COVID-19. So I think the muscle memory that countries have now are being utilized in a strategic way. So I think we're in a very different position than we were in the spring. But your other part of your question was about mortality and looking at differences in mortality. And all countries, everyone, everywhere, is better prepared at dealing with severe patients. So we have better testing, we have more rapid turnaround of results so that patients can enter the clinical pathway sooner. And if they can enter the clinical pathway sooner, they can have their vitals checked, and so we can check their oxygen levels. If they need to be administered oxygen, that can happen faster, and faster administration of oxygen saves lives. There's dexamethasone, which is widely available all over the world. That can be administered to people who are severe or critically ill. That saves lives. There are many things that doctors and nurses and medical professionals who now have experience with this disease know that are saving lives. So I think that there's a lot of, we're not in the same position. We're in this for the long haul together, but we're not in the same position we were in a few months ago. We know a lot more, and now is the time to be really strategic and smart about how we utilize all of these interventions where they are needed most.
Thank you. Now I would like to invite Peter Schilling from the European News Agency to ask the next question. Peter, can you hear me?
Yes, perfectly. Can you hear me?
Yes, very well. Go ahead, please.
Okay. Yeah, I'd like to come back to the issue with vaccination, looking after for a new vaccine as such, because on the 13th of October, Eli Lilly, they paused the ongoing study for their treatment of COVID-19. That was only 24 hours before Johnson & Johnson did exactly the same. These are very large multinationals that should have the technology and, let's say, the knowledge available in their labs to do a good job. On the COVAX facility, I can't really find back how many people are really working on the development of this vaccine. And I'd like to know, to what extent does now WHO interpret these delays of the third phase testing that is taking place? Does that really mean that vaccination will indeed be much delayed, so well into next year? And last but not least, with vaccination, one is aiming to, let's say, help out one of the most at-risk people, that being the older people. And it's known that vaccination really on older people doesn't work very well. So where do we really stand with the approach on vaccination?
Thank you, Peter. I would like to ask Dr. Swaminathan to take your questions. Thank you, Dr. Swaminathan.
Thank you. Those are all excellent questions. So the first one is on the stoppage of the studies. You mentioned two trials, the Eli Lilly trial, which is actually a trial of monoclonal antibodies. So not a vaccine, but a monoclonal antibody is now being tested in an approach to both prevent infection among people who are exposed, to prevent progression of disease among those who have the infection but very mild illness, and also in a group of patients who are hospitalized with COVID. So it's in this particular group of patients hospitalized with COVID where the antibody was being tested was halted by the Data Safety Monitoring Committee. And we're still waiting for details of that. But obviously, the Data Safety Monitoring Committee is the committee that looks at the blinded data, so the investigators are not aware of what the issues are. And I think we will hear something more later this week or next week about that particular study. But there are other trials of monoclonal antibodies that are ongoing. So this is a space that we need to watch. And it's possible that these antibodies would also have a role to play in prevention, though we know that it's short-lived. It'll be shorter-lived than a vaccine, because antibodies have a half-life in the body, which is about 20 days or so. So if you give somebody an injection, then over a period of time, that protection will wane. The other trial you mentioned is the Johnson & Johnson vaccine trial, which is an adenovirus 26 vaccine platform. And this vaccine trial has been halted. Again, we don't know the details of what has happened, but we know a patient had a serious adverse event. And this is a part of the conduct of clinical trials. You mentioned that these are companies that know what they're doing. So this is why the trials are set up in a way that safety is monitored, and that if there is any signal, then the trial is halted. The Data Safety Monitoring Committee looks into the details and then makes a decision based on whether or not this side effect was related to the vaccine, and whether or not it's serious enough to have a longer halt, or whether the trial could resume. So again, we're waiting for further information. But on the whole, this is exactly what happens in clinical trials. It's just that now everything is under the spotlight, and so we see all of these events as they're unfolding. But this is not something to get unduly worried about. This is something that we have to watch, and because there are so many vaccines in trial and will be going into phase 3 trials, I think we need to stay hopeful and optimistic. So that brings me to your other question of what's happening with the whole space of vaccines. When will we have a vaccine? This is something that we're tracking. So WHO has a landscape document that gets updated on our website, where we look at how many candidates at what stages of development. And we know that there are over 45 candidates now in phase 3 studies, so lots of data will be coming through. We're looking at the beginning of next year, really, to start seeing data from many of the trials, though we may see 1 or 2 before the end of the year. But the majority will start reporting in early 2021. And that's when then we'll be able to see the data, the regulators will see the data. Many of these companies are already manufacturing several millions of doses. So as soon as the results are out, if it's promising, companies will be able to start providing those doses to the COVAX facility, which will then distribute based on the fair allocation framework that we have developed and that we've talked about, which prioritizes which group of people should get the vaccine, but equitably across all countries. So not a few people in a few countries, but a few people in all countries, the most high risk to be protected. So the timing of that is probably somewhere in the middle of 2021 that we're going to start seeing countries but again, selected high-risk groups of people getting vaccinated. On the older people, your question is absolutely correct, that as you age, your immune system is less robust in its response, and therefore some vaccines don't work as well. But again, there is good news, because some of the vaccines in development now are showing very good immunogenicity in older people as well. And that's data from the phase 2 trials that we've seen. So there are some of the vaccines, certainly, that are showing promising results even amongst the older people. So hopefully we will have some vaccines that will be effective, because we know older people are a high-risk group, and it would be important to protect them with vaccines. I hope that answers your questions.
Thank you. I would like now to ask Shen from China Daily to ask the next question. Shen, can you hear me?
Thank you. Yeah, I'm based in Brussels, so I want to go back to the Europe question. Could you, Michael, Maria, talk about what do you think are the, you keep talking about applying all the tools. What are the tools Europe missing? Because, Belgium is shutting down the restaurant, bars for a month. But if that's not actually the loophole they are missing, so that's not going to solve the problem, even after months. Is contact tracing, because I've attended a press conference for months. So is the contact tracing, quarantine really being not forced well, strictly? Is that the problem compared to, China, East Asia you mentioned? Or is there other issues? Thank you.
Thank you, Shen. Dr. Ryan?
Again, it's difficult to make those comparisons. And again, if you look across Europe from our perspective, as our European region stretches from Vladivostok to Reykjavik, so you get a sense of the breadth we're talking here. So about half of our member states within the European region have experienced a 50% increase in cases in the last week. And if you actually put that to a 1/3 increase or more, that goes up to more like a 2/3 country. So clearly across the board we're seeing large increases in cases. What we are also beginning to see now is hospitalization starting to track that, and even deaths beginning to track that. And certainly going back even a couple of months, we would have maybe had 2,000 to 3,000 deaths per week. Even as much as 2 months 2 months ago, but now we're seeing a very large increase in the number of deaths per week, and it's now approaching something like 8,500 deaths per week across 48 countries. So you're definitely starting to see that tracking up of mortality. The question is, will it go back up to the very high levels we saw in March, April or not? And as Maria said, there's hope that that is not the case. Number one, the age profile of the positive cases at the moment is much younger. Certainly clinical care pathways have got better. People may be getting lower doses of exposure, and we have to look at this, and we are looking at this at the moment, to see whether the measures may not be fully effective at stopping transmission, but maybe the physical distance, maybe the masks, maybe all of that is reducing the dose of exposure that individuals are being exposed to, or the time of exposure. And exposure time and exposure dose are related to your likelihood, number one, to be infected, but in many infectious diseases, very often related to the severity of infection that you actually experience. So we have a lot of factors to look at in terms of why, number one, is the disease increasing? Can we keep that death rate down to the lowest possible level? And it may be, and as Maria said, when you look inside those numbers and inside countries, very often there are areas within countries that are driving a good percentage of that transmission. So the question for each country and for the whole region is, how can we get those numbers back down to manageable levels again in order to be able to fully re-engage on case identification, contact tracing and full quarantine of contacts. But let's be plain and honest here. If you are a case or you're someone who's positive, you should be at home in full isolation or in a clinical care facility. If you are a contact of a case, if you know yourself to be having been in contact with the case, you should be in full quarantine at home without contact with other people, or in a third facility and without contact with other people. And that is not so as to imprison people, that is so as to break chains of transmission. If we're seeing transmission now at community level, and then we do big major lockdowns and we push that transmission back into the household, and what we're seeing in many European countries and North America is that a good deal of transmission is occurring at the household level. So it's gatherings at home that are doing a good deal of the transmission. So even if you end up with a societal level lockdown and people continue to gather in those environments, we're still going to promote and continue transmission. So countries are facing many dilemmas right now. But for me, if I get a chance or a golden wish to improve one thing that we could really, really improve and change the game here, apart from all of the other advice about using masks and physical distance and asking that people can stay the course, and it's tough. But if I was being asked, as a public health physician, if I was asked for one thing that could improve, that might change the game here, that is making sure that each and every contact of a confirmed case is in quarantine for the appropriate period of time so as to break chains of transmission. And I do not believe that has occurred systematically anywhere, and particularly in countries that are experiencing large increases now. That has been very hard to sustain over the summer, and I think a good part of the reason why we're seeing such high numbers at the moment.
So I just want to supplement that, because you asked what are the tools, what needs to be done, and you've heard us say over many, many months about a comprehensive package of interventions, a comprehensive approach, and all of government, all of society. And the reason we keep saying that is because you cannot become overly reliant on any one measure. It can't just be testing alone. It can't just be case identification alone. It can't just be masks alone. It can't just be physical distancing alone. All of these interventions need to be used. And what we have seen in some countries is that there is an over-reliance on some measures as opposed to others. And you've heard Mike and I talk quite a lot today about isolation of cases and quarantining of contacts. And we really can't emphasize this enough. So this comprehensive approach includes active case finding, making sure you do active case finding and cluster investigations when you have outbreaks. It's the earlier identification of cases, using your testing wisely, getting those results back as quickly as possible so that public health actions can take place. That includes entering a clinical care pathway for a confirmed case, making sure that they are isolated in a medical facility if necessary, or at home if they can't be isolated in a medical facility. It's the identification of contacts of everyone who's been in contact with that case. And just think to yourself what you've done in the last few days. How many contacts, how many people have you come in contact with in the last few days? That needs to be done if you were to become a case. And that's difficult to do. You have to find all of those contacts, and they need to be in quarantine. And that means staying home or being in quarantine in another facility, fully supported by the government and the system there. It means readying your hospitals, making sure that hospital beds are available, making sure that ICU beds are available, making sure that there's appropriate trained, rested medical care, personnel, making sure that there's PPE available in the hospitals where necessary. It means looking at the data that you're collecting. It means using the surveillance data that you have, the testing data that you have, the contact tracing that you have, the analysis that you are doing to see what is actually happening in the country, what is happening at that subnational level, and using that to feed back into your response. What are the next steps? Where do I need to focus most of the energy with the resources and the capacities that we have? And it means regular, open, honest communication. So not only because the situation is changing, and this is difficult. And I think everybody is expecting this to be over very, very quickly, but this is going to take some time. And I think we all need to be mentally prepared about that. And this is not to scare everyone, but it's just to get ourselves ready that it's going to take some time for us to get through this, but that we will get through this. But open, honest, regular conversation with communities, feedback from communities to be able to determine, what it is that communities and individuals need to be able to take action. It also means individual measures that you take, that your loved ones take to protect yourself. So it's all of the individual measures of, avoiding the crowded spaces. It's teleworking if you can. It's staying home if you are asked. It's physical distancing. It's wearing a mask, but please continue to physical distance, even if you're wearing a mask. To use your hand gel, carry a hand gel around with you, wash your hands. And around the world, people are trying to make sure that we have adequate hand washing stations to improve access to hand washing. And it's about being informed, knowing your risk, taking decisions every day. Your decisions that you take every day matter. What is it that you can do to reduce your exposure and your risk and the chances of you getting infected or the chances of you passing it on to somebody else? So it's all of that, but we cannot become overly reliant on any one measure. It needs to be this comprehensive approach. Otherwise, there will be a false sense of security if we rely on only one or two of these measures.
Thank you. We have reached 1 hour, and I would like to end this press conference by inviting Dr. Tedros for final words. Dr. Tedros, you have the floor.
Oh, thank you again, Fadila. We Are a Family is more than a song. It's a call to action for collaboration and kindness, and a reminder of the strengths of family and the importance of coming together to help others in times of need. It represents that to heal the world from this pandemic, we must come together like never before in national unity and global solidarity. We're family, and as humankind, we have more in common with one another than we would ever dare to believe. Let us use this anthem, We're Family, to help unite us, unite the world, and together we won't just beat this pandemic, we will take on and successfully tackle other global challenges like air pollution and the climate crisis. So join us in the We Are One Family campaign, because together we can do anything we put our minds to. National unity and global solidarity. We're one family. thank you all for joining, and see you in our next presser. Thank you. And thank you to Kim and Natasha.
Thank you, Dr. Tedros, and I would like to thank journalists who are following our press briefing regularly, and I do apologize for those I wasn't able to take their questions for time constraints. Don't hesitate to contact us if you have any follow-up question. I remind you that we will be sending you the audio file of this press conference alongside with the DG opening remarks. The full transcript will be available tomorrow morning on our website. Thank you and see you very soon.